my name's Melanie and I'll be your nurse today. I need to do an assessment on your abdomen and your upper extremities. This might take about 10 minutes and it shouldn't hurt. Is that okay?
Yep.
Okay. I'd first like to see your wrists. Any tenderness?
Nope.
Of course, on all the extremities, I'd be assessing both. So I could document the skin is smooth, no swelling or lesions. I do need to do some range of motion with you. If you can bend your wrists back for me and forward. And then we're going to bend just at the fingers. Can you bend your fingers down and up? Okay, can you make a fist for me? And spread your fingers out. Okay, can you touch each finger to your thumb? Alright, I do want you to put your hands on this table here. And if you can tilt your wrists inward without moving your wrists. Without moving your arms. So if you can do this. Okay, and then move them out the other way. Okay. I need to test your muscle strength. So, if I can have your arm, I'm gonna hold right here. And if you can try to pull your wrists towards yourself as I apply resistance, great. Okay. Now I'd like to look at your elbows. All right, no redness, swelling, or deformities. Okay, I'm gonna have you bend at your elbow for me and straighten it out. Okay, if you can put palms up and then flip them over for me. Okay, I'm gonna check your muscle resistance. You can bend your arm here. Okay, try to pull to you. Awesome. Okay, and then try to push away. Okay, great. All right, I'd like to look at your shoulders. Okay, no redness, swelling, or muscle atrophy. Okay. All right, can you straighten your arm or raise your arms up all the way? And then let them drop down and then swing them behind you all the way. Okay. All right, can you bring your arms out wide and up over your head? Okay, and let them drop down, and then you're going to swing them out in front of you. Awesome. Okay, can you put your hands behind your back, just like this, okay? And then can you put your hands behind your head? Awesome. Any tenderness in your shoulder?
No.
Okay. All right, thank you. Muscles are symmetric. No nodules or deformities. Full range of motion in wrists, elbows, and shoulders with gravity and resistance. No crepitus in the shoulders. Okay. I need to assess your supraclavicular and your infraclavicular areas. Any tenderness?
Nope.
No bulging, discoloration, or edema. Okay. I need to assess your underarm here. If I can have your arm, and I'm going to have you relax that arm for me. So, of course, my workspace would be a little bit more even, and I would be I wouldn't be up so high. Any tenderness?
Nope.
No rash or inflammation. No tenderness or masses noted. Axillary and lateral arm lymph nodes, non-palpable. I do need to assess your chest. Any tenderness? So I could document male breast, normal male, no masses or gynecomastia or discharge. Okay, I'm going to have you lay back for me on this pillow to have his head at a 45-degree angle. I'm going to pull this pillow back just a little bit. Okay, and if you can look to your left for me. I'm looking here. No jugular venous distension. Okay, I'm going to look at your chest. All right. I want to find the apical So the apical impulse is the 5th intercostal space and midclavicular line. And then we would assess the precordium. So I'd be looking for any heaves or lifts, and they're usually at the sternal border or the apex. So you're assessing that as well as palpating. So for the precordium, I could say no heaves or lifts, and no thrills with palpation. Okay, I need to assess listen to your heart rate. So I could document apical pulse, 68 beats a minute, rhythm regular. Now I need to assess the heart at the 5 points, which would be the aortic, the pulmonic, Erb's point, tricuspid, and mitral. I would first go through with my diaphragm, and then come back through all those same areas with my bell. And then at the end, I'd like to listen to the apex with the bell, with him on his left side. And that you can find the S3 and S4 murmurs that are sometimes only found on that left side. So I'm going to listen with my diaphragm. So for heart sounds, I could say S1 and S2, normal. No S3, S4, extra sounds or murmurs. Okay, I'd like to move on to your abdomen. So we're going to note the contour. So I could say contour flat. You're going to want to assess symmetry, and it says you can use a light to look straight across. Of course, their shirt would be up, but you can assess symmetry better that way, and even from the end of the bed, it's said. So you could say symmetric with no bulging. The skin, abdomen free of striae, scars, rashes, or lesions. Assessing the abdomen, I can see the umbilicus in the midline, recessed with no bulging, and I could note no pulsations. Okay. Then I want to listen to your belly. I'm going to listen to the bowel sounds in all 4 quadrants, and I'm starting in the right lower quadrant, listening with my diaphragm only. So I could say 23 bowel sounds heard throughout. Then you want to assess your arteries using the bell. So first I'm going to listen to the aorta, and then I'm listening to the renal arteries, and then we'll move down to the iliac arteries, and then down to the femoral arteries. Listen here. Okay, no bruits. Okay, so now we would percuss the abdomen, and we would be starting in the right lower quadrant. So you could say, or you could document percussion revealed generalized tympany in all 4 quadrants. Okay, so at this time we can move on to palpation. So I'm going to first go through and do a light palpation, and then the second go round do the deep palpation. So if you have any tenderness, let me know. No tenderness?
No.
Okay. And then with the deep palpation, you can use 2 hands. Okay, so you could document no tenderness or guarding with light and deep palpation. Okay, next you could try to locate the aortic pulsation. So it is usually just a little bit left of the midline. And so you're going to try to palpate and feel the aorta. And what you're doing is when you find the border, you can mark it with one finger, and then you're going to find the other border, and it's usually 2.5 to 4 centimeters wide. So like I said, once you find it, then you're going to keep palpating. And you could document aortic pulsation 2.5 centimeters wide and pulsates in the anterior direction. Okay, you do want to palpate the femoral arteries. I'm just going to palpate right here. And you would, of course, do both sides. So you could document femoral artery 2+ and equal bilaterally. Okay, and that's it for you. Thank you. So for the breast model, for the breast model, I would have the female to raise her arms up like this, put her hands on her hips and push down, as well as put her hands together and push, and all the while I am assessing for mobility, dimpling, and symmetry. And so I could document free movement of breasts with position changes of hands and arms. No dimpling, breast symmetric. Then I would need to palpate the breast, the tail of Spence, and the areola. And so when you're palpating, you can palpate in an up and down motion all throughout. You can also go from the nipple out in all directions as you're palpating. Or you could you could do concentric circles from the areola out. And so you could document breast color light or pale pink, areola light brown. No tenderness or masses noted on palpation. You do need to palpate the nipple, so you could palpate it like this, and you could document no discharge from nipples. Now when you assess the axilla on the female, you do need to of course assess the tail of Spence, and in this area you would also be looking for enlarged lymph nodes or masses. Thank you.